So you're massaging that area, you're increasing the blood flow, and you're bringing those toxins to the surface. Now, and then since you have increased blood flow, then the blood can clear those toxins out and the lymph system out. So you can bring all that stuff out and get it out. So the way the Chinese will look at it is you're bringing that stagnant qi or that blocked qi to the surface so the body can get rid of it. You know, Western medicine-wise, you're getting the toxins out, getting the blood flow, getting circulation. So now the body's going to function better and clean, be a little bit of a cleaner environment. Okay. So that's some of the things that we use, and there's still other things that we use in the office. There's so many different things, you know, and as depending on the case and depending on what we're using and what we're doing, every patient is different, and we treat every patient as different. It's not like a mill that, you know, okay, everybody's got flu today, you know, everybody's getting the same medication, let's just move you on. You know, we look at everybody differently. You know, even when it comes to diabetes, for instance, you know, we work with a lot of diabetes patients. Western medicine-wise, there's one way that it works. You know, your pancreas has got a problem, and it's not producing insulin, and so you work with that, with giving the right medication for it. When it comes to Chinese medicine, we look at it, there's 3 different things that could cause diabetes, and it could be a liver stagnation problem, or a kidney problem, or a gallbladder issue. You know, so all those, we have to determine which one is it that this particular patient has, what kind of herbs can we use, what kind of modalities can we use. So does anybody have any questions so far? Yes? Back there.
On the cup thing, does it leave marks? Like, you know, when you suck the cup to your
On the
face,
skin?
do you have the red ring? Do you have red rings all over your back?
Sometimes, yeah. Depends on how, you know, how bad the person is, you know, depends on what kind of stagnation you got. A lot of times, it'll definitely bring, you'll get redness on the back, you know, where the cups were at, because you got the blood flow going. But there are sometimes you might even have like little bruise marks. You know. There's a movie out, and I haven't seen it yet, but there's a movie, I think it's called Cupping, or Cupping is in the Word. It's almost like a documentary where this family, they had a kid that was sick, you know, he had lung issues. The grandpa used cupping on him, and it left some bruises. Well, he went to school, and everybody thought that he was being physically abused, so then they had to go through this big fiasco. But it was really more of a cultural thing, and, you know, this is how they healed their kids. So it became like it was a big deal.
How long do the bruises last?
What's it?
How long do the bruises?
Oh, a couple days. Yeah, the bruise will be there a day or two, then it'll go away. It's not a real severe bruise. It's just you know, you're bringing that to the surface. You know, just like you know, any kind of suction you put on the skin. You know, if you do it long enough, it's going to make a little bruise on it. All right. So you had a question?
Yeah, I was just looking at some of the places that they do or some of the conditions for acupuncture.
Mm-hmm.
What would you do for gingivitis? Does gingivitis work?
Yeah. With gingivitis, the way Chinese look at it is you have, they would call it, you know, like your stomach fire rising, you know, or something along that line. The way they look at it, you take food in, it goes into your stomach, and in the stomach, that's where everything gets broken down. Okay. Then that energy from that food goes up into the lungs, and the lungs put it out into the blood, and then that is what nourishes your body. If you have a breakdown somewhere in there, especially with the stomach, okay, the food's going in, but it's not breaking down properly. So then you would work on what they call the stomach meridian, or the triple heater meridian, they call it, to help to get that flowing and get that working again. So now the body can work better, and that's where it would help with gingivitis and any kind of bad breath or anything like that. Yes?
I just remember, I was amazed at how you could identify
Donna,
what
can you
part.
speak up so people can hear you?
I was just saying, I just remember, because I've been to Dr. Thayer before, and I was amazed at how you could identify parts of the body that maybe or are troubling us that we're really not even aware of.
Right, and then, so what she's saying that, you know, when you come to an acupuncturist, you know, you might have a symptom in one area, but it could be a problem somewhere else. So with the acupuncture, we try to identify that. Like, you know, for instance, you have the bladder meridian, okay? It starts at the eye, goes around the head, down the back, and down into the foot, okay? So you might have foot problems, and you come in for a foot problem, but it's that whole bladder meridian. So it could affect your bladder, it can affect your back pains, it can affect vision. So a person's symptom could be foot pain. As we start talking, oh yeah, well yeah, I get this little blurry vision every now and then, and I've got this back pain, I get headaches, but it's all related to the same meridian. So by knowing where these meridians flow and what they control, and how one meridian helps another meridian, then it's kind of helps put the pieces of the puzzle together. Does that answer?
Yes. I thought that was amazing.
Yeah. Any other questions? Yes.
I'm just trying to figure out with this depression stuff, how many or what is, I guess if there's a percentage or a ratio, how many people walk in with depression and active acupuncture or something that they feel better? How many, like, some people,
Yeah.
some people say chiropractic doesn't work, so they go with modern medicine and stuff, but in your experience, how many people come in and treat them?
Okay. So basically, how does a person respond to the acupuncture or to the chiropractic? Everybody responds differently. Okay. I've got some patients, they've come in and we've done one treatment and they're cured. Their symptoms are gone, and everything's better. And we've had a handful of them. So that does happen. They come in one visit and they're set. We always shoot for that, but that's not the norm. Usually, most people that come in, they'll feel a little bit better. They come in for another visit, they'll feel a little bit better, and they gradually get better as the treatments go on. I've had some patients where they'll come in and maybe 5 or 6 treatments, they don't notice anything. But then on treatment 6, now all of a sudden things start to kick in. The average for a patient coming in is about 12 visits. That's kind of the average. Usually by 12 visits, we've got you completely cleared up, or depending on the situation, like diabetes, for instance, we're never going to let that. It's never going to go away, but at least we get it a little where it's a little bit more manageable and controllable. Your blood sugars are controlled, so you're able to maintain. And on a case like with diabetes or fibromyalgia, it's something that's always going to be there. But by coming to the acupuncturist and chiropractor, once a month, once every 3 months, kind of maintain kind of more of a maintenance program, then you fare a lot better. Okay? So most people get some sort of result. There are a few cases where they don't. And again, it depends on what's going on with that person. We work with people with ringing of the ears, and ringing of the ears, there's different situations of why you have ringing of the ears, but one of them could be, nerve damage, where a nerve is actually cut or so damaged it's not going to regenerate. So we can work all day long, but if that nerve is cut, it's not going to work. So those kinds of people aren't going to have a good result. But the person standing next to them, 3 visits may have cleared them all up. So success rate with the acupuncture, it's just phenomenal how people get better with it. And I've got so many people that come in and they're so skeptical. It's like, oh, this is never going to work. They come in even with a bad attitude, saying it's not going to work. And 3 visits, and they're saying, okay, prove me wrong. We're starting to see some results, even though they thought it wasn't going to happen. So we get really, really good results with the acupuncture and chiropractic.
Can I interject something here? I think this is something that we're finally catching up with in this country, instead of just looking at, what we consider the norm from medical care. Let's face it, people are not going to keep going back and putting out cash for something that they don't feel is benefiting them. They're not going to do that. And I think what's really interesting from my standpoint, because I'm a nurse and I've been in this field all my life, is now I'm beginning to see orthopedic offices and stuff have acupuncture and things that they would normally have not done years ago. Now they're open to, because they know that there's validity to it. So, it's not just, hey, we go to a chiropractic office or someone who practices alternative medicine anymore. You may go to a sports medicine clinic or orthopedic office and they're doing acupuncture and stuff. So this has, it's gaining validity, I think, all the time. And there's no way that people are going to put out money for something that's not working for them. So it's a different way of thinking about things. And when he was talking about cupping, I'm a nurse, so cupping is this to me. When somebody's all congested, you take your hands and you wrap on their chest walls and stuff. And one of our students that was with Dr. Thayer last quarter came in and said, oh my God, I saw the neatest thing yesterday. This older patient came in and she was all congested and they did cupping. And I was like, oh, okay, they'd be like, no. So she was explaining to me what they did. And she was amazed because the patient was feeling so much better. I believe she told me she was supposed to come back again, but she was feeling so much better after the one time that she didn't have to come back. Her breathing was so improved and stuff. So you can't argue with success. You know?
Yeah, and the medical doctors are getting more and more open to it. You know, I get a lot of medical doctors referring patients to us. You know, a lot of times we get the ones that they can't clear up. We get the trouble cases. You know, they've done everything they could, medicine-wise or you know, injection-wise. They didn't get anywhere, so they send them to us as a last resort, and then we get them cleared up. So now they're saying, well, maybe we shouldn't do it as a last resort. Maybe we should incorporate it. So it is becoming, you know, a lot more open to the medical world. They're getting a little more open to it, and also I think the patients are a little more open to it. You know, 20 years ago, you go to the doctor, and whatever the doctor said, that was the gospel. Okay, you take 2 aspirins and call me in the morning, and that's it. There's nothing else. There's no other options. You know, people now are like, okay, well, the aspirin thing, I don't know about. Maybe I should try something else. So the patients are becoming more educated, and you know, they're kind of questioning a little bit about what the medical doctors are doing. Okay, great, you're going to give me this medication for my joint pain, and then we find out 2 years later people are having heart attacks from it. Okay, people aren't too thrilled about that anymore. You know, now the medical doctor's going to give them you know, this pain for their blood pressure, and then okay, well, if I start taking it now, am I going to find out 3 years from now I'm going to have, you know, a tumor or something? So people are a little bit taking their health care a little bit more into their own hands, you know, which I think is great. You know, you should be a little bit more in control of what it is you're doing and what's being done to your body and what you need with your body and all that. Another statistic too with acupuncture is a lot of patients, they've done surveys, a lot of people would come to an acupuncturist, but they're afraid of the needles. Okay, so they say 60% of all people don't come to the acupuncturist because they're afraid of the needles. Okay, so if you come to an acupuncturist, I like to use the needles because it's a little more traditional. Okay, but people are still have, you know, needle phobics. You know, when they were, you know, 5 years old, somebody gave them this big vaccination with this big, huge needle about this big and this long. You know, so they're petrified of these things. So there's other ways that we can do acupuncture. We can do it with electrical stimulation, which is just a machine that we just come up to that point and we just hold it on there, and you'll feel a little bit of electrical current, so just a little tingling sensation. Okay? And then we can also use laser, and with laser you don't feel anything at all. It's just a little red light you put on there, and it stimulates those acupuncture points, which stimulates the nervous system, which gets it to work. Okay? They work just as good as the needles. So.
I didn't feel anything with the needles either, though.
Yeah. Oh yeah, and the needles, 90% of the needles when we put them in, you don't feel them at all. Sometimes you might feel a little mosquito bite sensation, and that's it. You know, so there's nothing to it. Matter of fact, a lot of patients, I'd start putting the needles in, and I'd ask them how many needles did I put in, and they'll say 3, but I actually put in 15. So it's there's nothing to it.